Hi, I'm Brady Frederick, and welcome to XConnect Northwest, the show that connects you to the experts. Ever since WSU quarterback Tyler Hilinski's death by suicide in 2018, the conversation regarding mental health in Pullman and around the world is changing. We spoke to Dr. Jennifer Ellsworth, the Director of Counseling and Psychological Services at WSU, to see how the university is responding to those changes. Here's an excerpt from that interview.
There are a lot of things happening at a lot of different levels to support college student mental health. At the state level, there's been a work group working to implement initiatives from a recent Senate bill that's focused on suicide prevention and behavioral health in higher education. And there are three parts of that bill. So the first part of the bill is to make more resources available to campuses across the state, broadly defined. Some of those resources are things like an annual conference that schools can attend. That was held just last week on the west side. It also involves developing web-based resources that students and campuses can access to provide more training for faculty, staff, and students, and also things like sample protocols for how to manage a crisis. So that's the first part. The second part is developing a grant program to make more financing available to support schools, especially targeting those schools who have less financial resources and high mental health needs for their students. And then the third piece of that bill would be to create a statewide data collection program and to coordinate getting annual reports from schools so that the state of Washington can really better understand what's happening for our students. So that's an example of the state level. I would also love to share a little bit about what the university's doing. I think at the university, we're really lucky at Washington State on the Pullman campus that there's a campus-wide priority on mental health. It's not seen as just something that belongs to Cougar Health Services. So there are a range of things happening from treatment all the way to interventions and resources for students who might not ever seek professional help. So I would love to talk about some of those. On the treatment side, at Cougar Health Services, students can come into counseling and psychological services and speak with a counselor. There's individual therapy, there's group therapy, there's one-time interventions. There's really a wide range that we offer. Students can also talk with medical providers in the medical clinic about their mental health concerns. I think some of the broad campus initiatives are really fun to talk about as well. There's been a lot of effort to provide more training for faculty and staff on how to have conversations with students about mental health. So there's training at new faculty orientation. We've met with Faculty Senate. There's online guides available so that faculty and staff feel like they're equipped to have conversations with students, and also so they know the resources and can make referrals when it's appropriate. This year, Student Affairs and Athletics have also partnered to really bring in speakers and to host events that can reach the broader student body. So that's been really fun to be a part of. And finally, I think one of my favorites would be, in terms of creativity, would be something out of the Health Promotion Office in Cougar Health Services, which would be a text message-based stress management program where students can text in and they can sign up to get weekly tips on how to manage stress, and they also get weekly check-ins.
So now in today's social atmosphere, another new change is that almost every aspect of their social life is online through social media. Do you think this affects mental health?
Yes, I think it can. And I think one of the challenges around mental health is we're human, and it's human nature to compare ourselves, and social comparison really thrives online. So we're comparing our lives to all the pieces of other people's lives that we see on social media, and after looking at everyone else's lives, it's pretty easy to come away feeling like everyone's life is better than ours, cooler than ours, or having more fun than us. Increased smartphone use, social media use has been linked to feelings of depression and loneliness. But the good news is there's also research that suggests if we scale back our time, if we just use social media less than we normally would, that can really decrease and serve as a buffer against feelings of depression and isolation. We don't have to cut it out entirely, we just have to use it in moderation.
Well, that's good to hear, because obviously the average student isn't going to cut social media completely out of their life, but it is nice to know that it can be beneficial to them in moderation.
Yes.
So which groups of students would you say in general suffer from mental health the most? We talking with people from the Helinski's Hope Foundation about student athletes. Do you think they or other student groups have a different stigma regarding mental health?
I think there are a lot of different student groups on campus who experience unique stressors that impact their mental health. So student athletes for sure are one example of a student group. They have a lot of demands on their time, a lot of pressure to perform, and there really can be an environment of prioritizing mental toughness and not looking weak. I think there are other groups as well. International students, for example, are coming to a new country and dealing with culture shock. They have to acclimate to a new language, new social expectations, new academic expectations, new foods. That can have an impact on mental health. I think students of color often experience discrimination, and that has a really adverse effect on mental health. Another example would be graduate students who can face a lot of unique pressures that are really intense related to their academic programs. So I think there are a lot of student groups that are impacted around mental health in different ways. And really every student on this campus has a unique constellation of things that are supporting them, ways that they have strengths, people in their corner, skills that they have. They also have a unique constellation of pressures and challenges. So I think it goes back to the idea that we're all going to experience ups and downs in our mental health over the course of our lives. And I think this kind of conversation is really beneficial to reduce stigma, to communicate the message that there are things we can do to take care of our mental health, and also for people to have the idea that there are resources out there when you might need professional help.
Well, thank you so much for coming on the show today, and I appreciate your work as you continue to help change the stigma on campus regarding mental health.
Great, thank you.
But it's not only faculty who's raising awareness for mental health. Many students have been getting involved as well. I spoke with Andrew Cooper, a member of the Helinski's Hope 3 for 3 project team. Here's an excerpt from that interview. A new development in mental health is how ordinary people, such as students, are making efforts to raise awareness. Earlier in this spring, 6 WSU students launched the Helinski's Hope 3 for 3 challenge on social media. Today, we're joined by Andrew Cooper, a sports management student and a member of the WSU track and field team. He's one of the founders of the 3 for 3 project. Thank you for joining us today, Andrew.
Thank you for having me.
So as a student athlete at WSU, do you experience the pressures of both having a full class schedule while also training, competing, and traveling? Do you think it takes a toll on your mental health?
Being a student athlete isn't as glamorous as it looks, and really our self-worth is completely tied up in how well we can perform as athletes, and being able to train at your full capacity is 40 hours a week, then taking classes, traveling, managing all of that, managing internal pressures to be great and to be successful in our sports and our academics, but also managing the external pressures that come with that, whether that be teachers, your parents, your coaches, your athletic department, fans, and social media isn't helping any of that. And so really all of those combined together with, the stigma around sport and mental health, or the stigma that exists in sport for mental health, makes it very difficult for athletes to be vulnerable and ask for help when their whole life they've been taught, you got to be tough, you got to push through the pain. And now we're starting to realize that you have to ask for help, and that strength is asking for help.
Thanks for tuning in to the season finale of XConnect Northwest, the show that connects you to the experts. As always, if you'd like to reach out to us on social media, we're on Facebook at Northwest Public Broadcasting and on Twitter at NWP Broadcasting. And if you'd like to email us any questions, you can find us at info@nwpb.org. Thanks for watching. I'm Brady Frederick. We'll see you next time.